music began to play, 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 to play.
So basically what we're seeing here is a short axis view of the median nerve. You can see that oval honeycomb appearing thing right there underneath that yellow line. That is the median nerve right there. And it's surrounded by those hyperechoic structures are the flexor tendons of the wrist. And so what we're going to do is we're going to guide our 30 gauge needle in long axis to the probe, but short axis to the nerve, and inject a solution of ropivacaine, 400 nanogram per milliliter dexamethasone, and normal saline. There we go, 1, 2, 3. And so what I'm doing is kind of using the volume of the fluid to guide my needle tip as opposed to the needle tip itself. And you can kind of see the nerve separating away from the fascial layers. And then we'll redirect, go underneath. You always want to keep the tip of your needle in sight. There you go. Feeling away. And then essentially the goal is separate all the layers and try to get the nerve to appear as ovoid as possible. So there we have it. All done. So I saw something pretty cool the other day and I thought I'd share this with you guys. I was doing a right-sided C5 to C6 intra-articular facet joint injection, and shortly after I did the injection I took a shot of fluoroscopy and I saw this contrast pattern. Can anyone remember what that rare but cool phenomenon is called? Message me or comment below. Again, the only way to answer that would be to simultaneously review your imaging, if you have MRIs, to do a physical exam and take a detailed history from you. Because if you have a bulging disc there, but your pain is not primarily true disc pain, then the FSU or functional spinal unit procedure would be more suitable. Bulging discs are almost like wrinkles. Inevitably, we all get some sort of bulging disc. Does that mean that your disc has to be treated? No, not necessarily. And that's kind of one of the points we're trying to illustrate with this procedure, is that while the disc is an important piece in the degenerative process, it doesn't necessarily always have to be treated. And by treating the functional spinal unit and stabilizing everything around it, it gives the disc the best chance to sort of heal itself, which they do heal. Discs do regenerate on their own. It just takes a long time and they have to have all the supports possible. So the goal really is, by treating the functional spinal unit you are enabling the disc to sort of repair. The way we measure the outcomes is we have a series of questionnaires that target specific aspects of your life and of your experience with the back pain, how it affects you, how it disables you, what does it stop you from doing, and we track those things. So it's almost like taking a global look at the outcome. So whether or not the disc specifically is getting better or everything around the disc is getting better or whatever, if you are globally improving and you're improving in these specific facets of life, then we know the treatment is working.